So as I said before, my name is Pete Garrett. I'm the Executive Director of Programs and People here at Street Child. It's great to be able to connect with you from slightly grey and overcast south part of England, where I'm based. But I trust that you're well wherever you are. So thank you for joining us today. We're going to look at some of the educational challenges and indeed what we've been doing through the COVID-19 context that's affected all of us in, of course, very different ways. Here in the United Kingdom, we're sort of very fixated on COVID and what we can do in terms of lockdown, or what tier we might be in, and what might Christmas look like. You know, in different ways, we're seeing incredible challenges for the children with whom we engage, particularly children's on the margins of society in some really tough contexts. And so we set out a few weeks ago to try and understand those challenges more, and we did that by looking at three contexts where schools have begun to reopen after quite a long lockdown. And we sort of said, let's try and understand what's happening even though schools have reopened. And so we looked at Sierra Leone, we looked at Afghanistan, and we looked at the Democratic Republic of Congo. And so what we want to do today is share some of those results, some of those findings from the studies and the consultations that we've done, and draw out some important messages that are guiding our work. So I'm so grateful to be joined today by just a fantastic panel. Mohamed Tarai, who we all know as Papa, is a senior project manager with Street Child of Sierra Leone, a trusted partner in Sierra Leone, and many of you have heard about them before. And he's going to speak to us on the context in Sierra Leone. Siddharth Pillai, who works for Street Child Afghanistan, and who's a program manager there, joins us, and he will be shedding light on a very different context in Afghanistan and the challenges and successes that they've been having in picking up on those challenges. And then finally, we're going to go to Sophie Raw, who's our program manager for Street Child in Democratic Republic of Congo. And she's going to speak about what we and our partners are seeing in that context. So look, with no further ado, I'm going to hand over to Papa. And Papa, tell us about Sierra Leone. What have your surveys shown us?
Yeah, I'm fine. Hi, thank you very much for the brief introduction. And can you please go to the first slide? Yep. And for Sierra Leone context, we actually have a first COVID-19 case on the 21st of March 2020 that actually quickly spread out to communities probably in the western part of the country because of the high density of population. And on the 31st of March 2020, we had to close schools because we had an increase in the rate of infection. And that has to go down to September, where because the kids actually start coming down, so there was a need for school to reopen. And along that line, in between when schools were closed and when school opened, we have two lockdowns, and the movement of people were restricted, and we have intra-district lockdowns. People could not move from one district to another. And then we had to close some borders very close to our neighbors like Guinea and Liberia, just to curtail the spread of the virus. And also we were able to have some classes that have to do with end of year exams. For example, NPSs, so that we had to prepare these children for them to sit to these exams for learning to actually start to take place, because we start seeing the decline in the rate of infections in the country. What actually research is about, we did a research on the impact of COVID-19 on education in Sierra Leone. We were able to collect data from 10 schools across 4 districts, basically in Kaila, Kenema, Kono, and these districts are in the eastern part of the country, and Tunkulele in the northern part of the country. And the data was collected from 10 caregivers and 5 teachers specifically. So this is actually what I wanted to present to you, to take you through to what actually was the impact of COVID-19 on education in Sierra Leone. In terms of attendance, that actually has to do with the pre and the post attendance. Pre has to do with when schools were actually closed just before March, and then when we actually opened schools back in October. So we're looking at attendance within this specific period, 1 month each when schools were closed, and 1 month after schools actually opened quite recently. With regards to attendance, in overall, we have the average rate of monthly attendance dropped considerably by 9%, from 87% to 78% across the 5 project locations. And actually, what were the driving factors for the reduced rate of attendance? Despite the effort of teachers and the school authorities to actually prepare for the reopening of schools, that is engage in sanitization of school facilities and doing hygiene practice like regular hand washing and doing social distancing. But yet still there were some fears in the minds of caregivers to actually send their children to school. This was something that actually came up strongly in the research, for fear of their children for them to get contact with the virus in the school. So that actually was one of the reasons why these children will have a drop in rate in attendance rate, as seen from the figures that I've just mentioned, from 78% from 87% to 78%. That is in total 9% overall decline in the rates of attendance. And also, because of this fear among many families, even those schools that engaged in community sensitization through local media streaming, families were still faced with fear to send their children to school. That has not to send their children to school, but this also has not been effective in actually allaying the fears to get them prepared to go to school. So that's the idea of school attendance actually take me to my next slide, which has to deal with the monthly attendance of pre and the post COVID-19 closure. If you can look across my next slide, which has to do with attendance, we'll look at what in terms of age brackets. We have, for example, 10 to 12 years old. We have like 87% before schools actually closed for COVID-19, and 78% when school actually opened in October. And then, but if you look across the board, we have like the highest rate of school attendance was 11%, only for like age bracket between 14 years of age. But looking at what I have in front of me from the data of the research, overall 92%, but the highest rate of attendance actually was in Kono with 92% before schools were closed as a result of COVID, and 87% when schools were actually open in October. The lowest was Kailaun. Kailaun has the lowest rate of attendance for 85% before the pre-COVID status, and 69% when actually schools when schools open. But in terms of variation in attendance, if you look at the boys, if you look at the sex disaggregation, between 10 to 12, 13 and 14 have a reduced attendance rate by 12% compared to 15 and 20 with fewer lesser rate of 4%. For girls, attendance rate shows the reverse, as the oldest shows rate reduction in average attendance, that is 10%. So this, in effect, we're saying that the attendance rate across the 4 districts, Kono shows the highest rate of attendance with 90%, as opposed to Kailaun, which shows like 85% before actually school closed, and after and the post-COVID-19 era, which is 69. And looking at the data in terms of attendance.
Hopefully we'll get Papa back. But meanwhile, just talking about some of the things that Street Child of Sierra Leone are doing and would like to do more of. So continued support to participants within the project to allay the fears of COVID-19. He's already illustrated how actually that seems to have been quite a significant factor in the reduction of attendance rates. So just to encourage and ensure that children and families feel confident, feel safe about returning to school. And a link to this is to just ensure that there's really good adherence with the Ministry of Education's guidance in terms of COVID through the provision of masks, hand washing buckets and soap. What Papa was telling me a couple of days ago is just these basics are really important in instilling confidence and ensuring that everyone feels that they're coming into a safe environment and doing what they can in terms of lessening the impact of COVID. And again, as Papa touched on, Papa, maybe you're back. If you can hear us, I would just went through the first two points on this last slide. So happy for you to pick up and finish off.
Yes, Pete, can I, I'm lost with screen. Hello, Pete?
Yeah, we can hear you. We're just on the last slide of the Sierra Leone section, and we're just beginning to talk about family business. So maybe you can talk about the family business support that we're looking at doing.
Yeah, basically we for us to encourage retention, we plan to support families that have been affected by COVID-19 to actually support their kids in school. This can actually by providing business, training them, and then providing business grants to them. By doing this, we can be able to support retention in school. As before, I had a breakdown in network. We want to continue to support project beneficiaries, but actually by continuing to do community sensitization, awareness raising with regards to COVID-19, and also that we can create the confidence in the families to be able to send their children back to school. And we also want to support the government to adhere to its guidance by providing smart hand wash stations at schools to actually and protect or stop the spread of the virus. And finally, we want to support caregivers with family business training and also with business grants, so they can be able to increase attention. Back to you, Pete.
Yeah, Papa, just thank you so much, and especially for struggling on with a slightly dodgy connection. And just, a massive thank you to you and the teams that you lead and everything that you've done to, bridge the gap with these children and particularly, these marginalized groups, and just to encourage the reconnection into school. But I mean, I really picked up, and I want to sort of reinforce, that finding from that survey across those 4 districts, that basically 10% of students have not yet returned to school. I mean, 10% of students in the UK would be 1 million children not going back to school. So 10% in Sierra Leone, that is really, really significant. And that, for me, more than anything else, highlights the gap, the challenge that's in front of us, and that we want to help address. Thank you, Papa. Let's move on to a completely different context in Afghanistan. And Siddharth Pillai, or Sid as we know him, is going to take us through what they've observed from their surveys and their particular context. What's emerged for you, Sid?
Yeah, thanks, Pete. Thanks everyone once again for joining this webinar. Before I move further, I would like to give a brief to everyone about the Afghanistan context. 4 decades of political and security volatility in Afghanistan has impacted the access to education, with about 65% of the school-age children either out of school or attending school for less than 3 days a week. For the 5th consecutive year, Afghanistan remains the deadliest country for children, and insecurity takes a toll on the well-being of children in Afghanistan. A recent survey showed that 50% of the children surveyed have been found to have reported psychosocial needs. While considerable progress has been made in improving access to education in the last 2 decades, not much has been achieved when it comes to learning. Significant proportions of the students in Afghanistan enter and leave the education system without learning much. On average, a World Bank study shows that grade 4 students, after spending 4 years at school, they only display the knowledge of a grade 1 student. Next slide, please. Yeah, so it is in this context that COVID hit Afghanistan. As the schools and community-based education centers closed in March 2020 to contain the spread of the virus, 9.5 million children were deprived of their access to education, including the 3.7 million who were already out of school. As COVID-related closures further complicated the already existing livelihood crisis in Afghanistan, humanitarian organizations have reported an increase in adverse coping practices such as child labor and forced marriage. The video lectures which were developed by the Ministry of Education to ensure a continuity of a sense of learning among children was also accessible to a negligible proportion of children due to the lack of access to internet, television, and radio, which was further compounded by the frequent power outages in the country, both in the countryside as well as in the cities of Afghanistan. Next slide, please. So Street Child Afghanistan's response to this situation was three-pronged in the conflict-affected province of Uruzgan in southern Afghanistan. In Uruzgan, Street Child provides education in emergency services for 3,500 out-of-school children across 90 communities. The 3 intervention pillars basically focused on one, continued learning among children through printed self-learning packages, which was followed by weekly visits to their homes and feedback on the assessments which children had completed in the self-learning packages. Second was basically protection of children through informational sessions, identification of the children who are at risk and responding to their needs. And the third pillar was basically improving the capacity of the community to mitigate and respond to the COVID-related risk through awareness sessions. Next slide, please. Yeah, so ending the COVID-related school closures, schools reopened on 5th August as per the directions of provincial government. Given the context, Street Child came up with a scenario-based response whereby classes were conducted in open space as a resource-frugal method to ensure the safe reopening of schools. To maintain social distancing, classes were conducted in groups of 5 to 10 children across multiple shifts. And to ensure the compliance with COVID-related safety norms, teachers were trained and were monitored by the provincial team. Next slide, please. Yeah, so and our continued community engagement along with the above mentioned measures have contributed towards 99% of students returning to schools in the reopening phase, which is like in stark contrast to with what Papa was saying. However, Street Child faces major challenges in provision of quality education services in these fragile areas of Afghanistan. One of them is the continued maintenance of a sanitized environment in the classroom, given the threat of COVID. So in the areas where we are operating, like Uruzgan, preventing the spread of the virus through disinfectants, protective masks, and social distancing is the only option, as testing, tracing, and similar specialized services are absent in these areas. And coming to the more important problem which we face is the learning loss which has happened during COVID lockdown. Post-COVID lockdown, a large number of children are graduating to the next grade without gaining the competencies of the previous grade. Could you go to the next slide for a few minutes? Yeah, so when the schools reopened, we conducted an assessment of foundational literacy and numeracy skills of our grade 1 children aged 6 to 9 through one of our partners, ASR Afghanistan. So you could see the results in this table. So with respect to the reading skills, you could see ones which are marked in red, you could see that in the first table, 28% of our children can't identify numbers, while in the second table, you could see that 29% of our children couldn't identify numbers from 1 to 9. As shown in the table, you could also see that our children are in this extremely fragile province have done fairly better than their peers studying in government schools in Kabul. You could see that the two figures is basically the one is the Uruzgan figure and one is the Kabul figure. So our children have done fairly better than their government, the counterparts in government schools in Kabul. However, the fact is that the 6 months lockdown has led a sizable proportion of our children to move into grade 2 without gaining grade 1 skills. That's a huge concern for us. Could you go back to the previous slide? So in primary education sector, that would mean that by grade 4, when these children are to make an important transition from learning to read to reading to learn, a sizable proportion of our children would still be grappling with decoding words and identifying numbers. These children haven't dropped out now, but they might be pushed out later if we fail to plug this learning gap. What we feel is required are daily 1-hour remedial classes for these children, where trained teachers are able to assess the current learning levels around reading and numeracy and to tailor instructions accordingly. This shall ensure that our children are better placed for textbook-based learning in the subsequent grades. So in short, preventing the resurgence of COVID in classrooms in these fragile areas and tackling the learning loss which has occurred due to lockdown are the major challenges which we are facing. These are major challenges, but these are surmountable challenges with adequate resources. Thank you for your time. Over to you, Pete.
Yeah, again, Sid, thank you so much for everything you've had to share with us. Incredibly different context, and credit to you and the team and all our local partners for what they're doing. I'm really struck by, obviously, the survey looked in particular at the communities that we are actively working, and I guess I'm encouraged that retention rates have remained quite high, and I think that's credit to the intensive community-based education support that you and our partners have provided. But I'm really struck by the point that you make around that loss of learning, that lockdown and cessation of schooling activities has had an impact in terms of the basic foundational literacy standards. And there is such a big gap there. There already was a gap, but that gap is even bigger. And that seems to me like a really big challenge that's in front of us. Okay, Sid, thank you again. Let's move on to the last of our 3 presentations. And Sophie, who's a program manager for Street Child in the Great Lakes region, in particular, Democratic Republic of Congo. Sophie, over to you for what you've seen and our partners are telling you about the issues.
Hello, everybody, and thank you, Pete, for the introduction. So in DRC, what we did is we collected individualized data of 120 students in 15 target schools that we are currently targeting under the UK-aid FCDO-funded Safer Schools program. And we looked at data pre-school closures. So this was the month of March. So schools closed on the 21st of March in DR Congo. And then we looked at data 1 month post schools reopening, which was on the 12th of October for all schools years. And then in August for primary and secondary school finalists. And we also undertook key informant interviews with 5 teachers and 10 caregivers in communities where we operate in, but not necessarily target directly. And if I could have the next slide, please. And what we found rather dramatically in terms of attendance rates is amongst all 120 students, attendance, which was 94% preschool closures, dropped rather dramatically to 61% in October. So once schools had reopened. Could I have the next slide, please? And we also found gender disparity in attendance rates. The proportion of females with average attendance rates of below 50% since reopening is 38% compared to 25% of males. So to delve a little bit deeper, we held these key informant interviews with teachers and caregivers to try and get a bit of a better feel as to why there was such a sharp drop in attendance. And we found that this was largely due to the effects of the COVID-19 economic downturn and increase in prices on sort of everyday goods and essential items, and also the lack of alternative education available in our operational area, which led to the deprioritization of education for many struggling families. The lack of financial means also created opportunities for several child protection issues to arise, such as child labor, or informal labor, or formal labor. We saw that many girls were taking on more domestic chores than usual, taking time away from schooling, and that boys were having to help their families in fields as well, also taking time away from schooling. There were also other gendered drivers, including an alarming number of early marriages being reported. There was even one teacher who reported 5 cases of early marriages in their schools. And we were also alerted to recruitment into local armed groups remaining a big risk for boys as well, for lack of other opportunities. Furthermore, as mentioned previously, only a quarter of caregivers cited that their children have access to alternative learning during the school closures. Sadly, there's no radio coverage, there's no access to television in our operational area. So those who did have access to some form of distant learning was actually thanks to our local Congolese partner in partnership with Street Child, with whom we delivered exercise workbooks, sort of the official national approved ones by the Ministry of Education. Could I have the next slide, please? So what we did in response to the pandemic, but also to try and mitigate learning loss and really make sure that we were supporting the most marginalized and not leaving the most marginal, not leaving anyone behind, is so we distributed these primary and secondary school workbooks, as I mentioned before, to keep over 9,000 children engaged in learning. So the teachers that we support took the lead on this, and they did sort of small group learning sessions and home visits. We also continued to deliver our general and specialist teacher training workshops to teachers and head teachers to make sure that there wasn't a drop in the quality of education that we were providing, and that we were also keeping teachers motivated and in sort of continuous professional development. And then we also installed hand washing stations and put up posters in our secondary schools and primary schools to reach approximately 10,000 students and teachers. And also try and sort of, I guess, mitigate sort of safety concerns with regards to parents not so sure about sending their children back to school. And we also put up these hand washing stations in public spaces, so markets, churches, road crossings, as well, just to make sure that all community members had access to them. And finally, we also trained child protection committee members to do community awareness raising on COVID-19 prevention and door-to-door sensitization to the most vulnerable groups. And could I have the next slide, please? We launched a sort of community-led back to school sensitization campaign, again focused on promoting education for the most marginalized groups. And this is all in addition to our sort of regular sensitization activities, where we tackle early and forced marriage and other forms of sexual gender-based violence in particular, and other sort of peace building promotion activities, and sort of girls' education promotion. And when we also train those teachers, we also train them in psychosocial support, and we put in place psychosocial focal points in schools so that when students did come back, they always had someone to turn to, and those focal points would refer any cases to our child protection committees as well. We also managed to continue to run our accelerated learning program for over 300 out-of-school primary age children who are already beginning to reintegrate into mainstream schooling now. So again, this is a focus on making sure that the most marginalized aren't being left behind. And finally, we very importantly continue to support parents and caregivers through village savings and loan associations and a goat rearing scheme, as well as teachers through teacher-only VSLAs, to make sure that they have the ability to make savings, take out loans, and that profits would go towards sort of education costs, as well as diversifying sort of household income generating activities and health costs, debt repayments, whatever the sort of urgent household needs are at that point. Could I have the next slides, please? So what still needs to be done 1 year into this 3-year program is we need to further strengthen our community sensitization activities, specifically on education, early forced marriage, and other children's rights. We need to make sure that those out-of-school children enroll or reintegrate into school, and that they are supported to do so with learning materials and uniforms, for example. And we need to also catch up the learning loss of the past 6-7 months through continued support and sort of quality teacher coaching by our teacher trainers that we're currently doing at secondary school level, and is cascaded through to primary schools through our teacher support networks. And we also need to keep our schools and our communities safe. We need to make sure that masks are being used, that social distancing and hand washing is being enforced, that there's always a supply of soap available. And one way that we've also done that is to make sure that schools always have enough financial resources at their disposal for this to be sustainable. And we do this through our school enterprise scheme. So where they might decide to do a sort of animal rearing scheme, and then profits will go to support vulnerable students, or to repair a broken water tank, and so on. And of course, we need to continue to support parents and caregivers, so they are able to continue providing for their children. Now, this we are all having to do in a somewhat difficult context for everyone. I'm sure many of you have seen in the news that the UK government is planning to cut its development aid budget and either cut it or even not have a fixed budget at all. So 1 year into this 3-year program, this is obviously very worrying for us. And as always, this risks having the most impact on the most marginalized. Thank you.
Yeah, Sophie, thanks again, and thank you for everything that you've been doing with our partners in DR Congo to support them and to, you know, ensure that this incredibly important program can sort of adapt to the COVID context, but continue to do well. Yeah, sadly, that reduction has been confirmed this lunchtime, folks. So yeah, we're spending a lot more money on defence, and we're slashing international aid budgets. So yeah, that's going to be a challenge, and I think, you know, what you've done, Sophie, is illustrate you know, how important it is in these incredibly fragile contexts where you know, education of these children is just so important it's important to peace, it's important to helping the world to be a better place, and it's so important for their futures. And you know, to see that, okay, with admittedly a small sample size and in a very difficult context, but a 33% decline in attendance is really worrying, and I think re-emphasizes how important you know, your work and the work of our partners is to you know, do everything we can to address these gaps. So look, by way of sort of a summary, and we can, Hannah, you can hit the next slide, and we'll take. Well, let me first say, please think of any questions you'd like to ask any of the panelists, and I'll be happy to direct them and help them to answer those. So perhaps while I'm sort of summing up, please do put any questions that you've got into the Q&A box at the bottom of your screen. So yeah, I was struck by that, you know, a relatively small survey, but actually quite an important one. And you know, a 9% attendance decrease that we're seeing in those 4 districts where we work in Sierra Leone, and 1 in 10 children not coming back to school at all. That, you know, that's quite scary. DRC, 33% decline in attendance. And Sid highlighting in Afghanistan a slightly different context within the communities we directly support, where there's just a big loss of learning gap. And so that sort of basic literacy, that's sort of falling behind. And though our engagement with communities has helped to kind of keep children in school in that context, yes, those basic literacy sort of falling behind gaps are really evident. And I guess in the UK, you know, we might be talking about what can schools do to help children catch up, or what remedial action can be taken, and that's so much harder in these lower resource contexts. I'm really struck by, you know, kind of what you've been able to share, guys, in terms of what's behind, you know, the reasons for these figures, but that safety concerns about COVID has really come through. You know, that there are families that just don't feel comfortable with sending their children back into that environment, so everything we can do there is really helpful. And just the economic impact has come through loud and clear. And there's 2 sides to that. There's the costs involved. Even where school is free, we know that there are material costs involved in sending your child into that school. And the economic impact of COVID and lockdowns and the impact on economies throughout the world generally means that families can less and less afford those costs, but also maybe feel that they need to engage their children in some form of household income generation, possibly even child labour, to supplement household income. So we're seeing that quite significantly. And I think, Sophie, you sort of flagged, you know, we're seeing these sort of early marriage, teen pregnancy issues, and interestingly, in that particularly vulnerable context on the plateau in DRC, you know, we're seeing the attraction of armed groups providing an alternative for children, alternative to school. And that, again, that's sad to see, but I think a reality of some of those contexts. So, and all of that in a context where UK aid are about to cut budgets. Hey, so look, I'll sort of pause there, but only to say how, and this is why we have a Christmas fundraising appeal out right now. You can find it on our website if you haven't come across it so far. A Future for Every Child. You know, we want to get the children back into school. We want to look at alternative learning where that's needed, community learning, last mile learning, catch up and remedial learning, particularly for children on the margins. And we want to continue to work on the resilience with families and communities so that economically they can afford to prioritize their children and education.